All right, good morning. My name is Ryan Gunterman. I'm the executive director of the Indiana High School Press Association, and I'm really thrilled to be here and partnering with Family and Social Services Administration for this 988 awareness campaign. With participation today, we do have some student media outlets that are participating in-house as well as virtually. And so please wait to be called on for asking your questions, and also make sure that you speak into the mic so those who are participating virtually can hear you, those of you who are here for today's event. We're participating in 988 awareness because this is an incredibly significant topic to cover for student media outlets and for our age group that we cover, our constituents. As everyone I'm sure has seen, almost every single study has shown that our students are in the middle of a mental health crisis, and services such as 988 can literally save their lives. This topic is something that is being covered throughout the state in multiple student media outlets because of its significance and its personal impact. So many schools have experienced situations where students have taken their lives and they weren't aware of resources that could be available that could have prevented such a tragedy. This is just too important to not have the facts, to not have credible sourcing, and its significance to our constituents, to our audience, is so great that we have to make sure that we have the experts here in front and answering the questions, providing the information, and letting people know that this service that, again, can save lives is available. And so with that, I'm thrilled to introduce Dr. Dan Rosuniak, the Secretary of FSSA.
Thank you, Ryan, and thank you everyone for attending an important day to really help get out the message about 988 and the services that it can provide. Prior to my role here in state government, I was an academic physician and a researcher, and the last study that I led actually was looking at Indiana youth suicide. And I remember at the time we were looking at the year after year data, and it was right around 2012 we saw this really stark inflection point where we started to see every year after that the number of children between the age of 12 and 19 who were attempting and committing suicide go up. And I remember at that time looking at the graph, and every year it would increase. And so you would look at it and think, when is it going to end? And at the time you could think about, how are you going to impact this? How do you impact something that is so complicated? How do you take systems that are in place and really try to bend or really break that curve? So I couldn't at the time think how. But here we are today, I think, talking about 988, a year into it, and I think we can start to see the how we might do this. And it's one of the reasons why a little over a year ago when we launched 988 with the support of Governor Holcomb and the leadership of Jay Chowdhury and our Division of Mental Health and Addiction, that we looked at 988 not just as a call center, but as one part of a comprehensive statewide system. A system that could not only respond to individuals in crisis, whether that was a mental health crisis, suicidality crisis, or substance use disorder crisis, but a system that might be able to prevent and to start to change that curve. So that is why when we launched 988, we made it one part of a three-part comprehensive system. A system that we know can help individuals in crisis, because sometimes the care that they need is going to be more than you can provide on a phone. And so that's why the second part of that system is building what we call mobile crisis teams. And these are teams of trained mental health professionals and peers who can go in person for those individuals who need more. And it's also why we're building facilities around the state and supporting them that can specialize in crisis care for those individuals who need more than an on-site provider can provide. And so I think with the ongoing support from the governor's office and the legislature, right, we are on our way, I think, over the next 4 to 6 years of having a statewide system that assures that anyone in crisis, no matter where they live, the time of the day of the week, will have someone they can call, someone who can respond, and a safe place to go for help. And the first part of that, our 988 call center, which we'll be launching and discussing more about our media campaign. We have already seen tremendous success since launching that last July. We are almost every month in the top 5 states for our in-state answer rate, which has been over 90% since November. And a lot of that success really is due to our next speaker, which is Cara Byro, who is our State Director of Behavioral Health Crisis for the Division of Mental Health and Addiction. And she has truly poured her heart and her soul and more hours than I think anyone could count into really getting this launched and making sure that we're on our way to bending and breaking that curve.
Thank you, Dan, and thank you everyone for being here today. As Dr. Rosiniak stated, my name is Cara Byro, and I am the State Director of Behavioral Health Crisis Care. I've spent the past almost 2 years focusing on developing and implementing the state's 988 Suicide and Crisis Lifeline. So really that first pillar of these 3 pillars that Dr. Rosiniak was sharing, the someone to call. So many of you may know that there was a 10-digit National Suicide Lifeline that you could call. And as of July of last year, 2022, the federal government changed that to a 3-digit calling code. This was to ensure that individuals had quicker access to reach support for an individual that might be experiencing crisis. So when an individual calls 988, they're able to access support, a way forward. It's the beginning of their opportunity of getting help and to talk to someone who gets what they're going through. The Lifeline provides a direct connection for individuals with a trained crisis specialist that will be answered in the state of Indiana. And so 988 offers that accessible care and support for anyone that's experiencing mental health, substance use, or any other emotional distress. Whereas the 10-digit number was a focus on suicide prevention, 988 really allows and focuses on ensuring that individuals across the state, regardless of what crisis looks like for them, has someone that they can call to help stabilize them and get them the support that they need. So it's a way forward, and it's someone who gives you that non-judgmental support that you might need, and it's whatever help you need, even when you don't know what that might be. So when an individual calls 988, a question I get often is, what can I expect? There's always some anxiety about calling and talking to someone that you don't know. 988 is an anonymous and confidential lifeline, so individuals can talk about what they're going through without the worry of information being shared with anyone else. The state of Indiana has partnered with 5 in-state providers to provide that support to individuals in our state to answer all of those contacts to 988. And that's through calling, chatting, or texting. So ensuring that we can access an individual and that individuals can access the system regardless of how they choose to do so. All of the crisis specialists in Indiana are trained in suicide and crisis prevention and are required to pass a crisis simulation test and then additionally receive ongoing training throughout the year. When calling 988, individuals can expect help in the form of an empathetic ear, a means for support, and information and connection to helpful resources, regardless of what that might look like. Those 988 crisis specialists that an individual will reach can provide them with an ear to listen, the support, and any help that they can provide to an individual. You might be asked what your reasons are for calling, and that's really just to ensure that that crisis specialist knows how to meet you where you are. Our goal of this system is to ensure that individuals have the autonomy and the ability to say what they want their journey to look like to recovery, and to provide that additional support to individuals whenever they need it, no matter the time of day, and to give them the support that they want in the way that they want. So next, what I would like to do is to introduce a video and share a video with you all that describes and shows what our call centers and our mobile crisis teams have been doing and what the support that can be provided to an individual when they call 988.
I have always been passionate about suicide prevention for as long as I can remember, and I did lose somebody to suicide. As 988 became available, I wanted to be a part of that movement. Losing somebody to suicide is incredibly difficult, but it definitely has fueled my purpose today.
My parents, both of them were just an active addiction. I think if we had 988 available, if there was mobile crisis teams available, there would be some members of my family that would have been able to get the help that they needed, and maybe things wouldn't have transpired in their life.
988 means to me helping more Hoosiers. Those who maybe are uncomfortable speaking about their crises because of a stigma now have a place to go and reach out for help that's confidential.
I think sometimes that there's still a stigma on mental health or even substance abuse, and I think we've seen honestly since COVID, just the need of people knowing that there's somebody out there for them to talk to and knowing that they're not alone in whatever it is that they're facing.
It's truly beautiful to see the amount of people that call and the wide variety of reasons why individuals call, and that they find hope in reaching out to us.
Sometimes somebody just wants somebody to talk to and hear them out, and I think Hoosiers really need to understand that that's what that's for you to not have to deal with everything on your own.
It is incredibly rewarding to see my staff successfully navigate 988 calls. I love reading the reports. I love hearing the stories. I love receiving emails from my staff saying how proud they feel because of a successful call, and that means a lot to me. That really fuels me even more than just suicide prevention.
So as you can tell, there's a reason why we shared that video. I can stand up here all day and talk about how important this is and the support that an individual can receive. But hearing that from the individuals who are doing the work and the type of environment that we try to provide for our 988 crisis specialists to be able to provide the support to individuals experiencing crises in the state of Indiana is something that I think only those doing the work can share. So now you might be asking, what is a crisis? And I think this is a really important time to identify and acknowledge the fact that what is a crisis to me is different to each and every one of you that are here today. So it's really important for us to ensure that we aren't defining what that crisis is. Individuals experiencing a crisis, it can be anything such as, a child that's not wanting to eat dinner or wanting to get to school, parents that are fighting all the time, not knowing where you fit in at school, relationship issues, money, anxiety, stress, anything like that can be a crisis, and it is not up to us to define what that is for each person. This 988 Suicide and Crisis Lifeline is there to support individuals regardless of what their crisis looks like, and to provide that support that maybe you don't feel comfortable reaching out to someone you know, but will also help you stabilize and identify a plan to keep you safe and to connect you with the resources that you need to stay in the community and to stabilize and to receive the support that you need. So with that being said, I have the privilege of introducing one of our Indiana Youth Advisory Board members. Kylie Roop is a recent 2023 graduate of Avon High School and has a passion for mental health advocacy and is here today to help us talk about Indiana Youth Advisory Board and the importance of youth's voice as we talk about something as important as 988. Kylie?
Hi, I'm Kylie Roop. I'm an Indiana Youth Advisory Board member. I joined the Indiana Youth Advisory Board because I get to be a part of a diverse group of youth and young adults that are passionate about shaping the future of Indiana and public health services, including suicide prevention. The board serves as advocates for the youth of Indiana and provides guidance to state leaders on programs and services like 988 that are working to improve the quality of life across Indiana. This National Suicide Prevention Month, it is important to understand that suicide is the second leading cause of death in young people ages 10 to 24. As young people, sometimes it can feel as though your struggles are being underestimated due to your age. These struggles could be something you experience so often you don't even recognize that it is a crisis. These struggles could be family conflicts, relationship hardships, or even school pressures, and so much more. They can feel overwhelming and impossible to deal with alone, but it's important to know that you are not alone and that support is available. Please watch this next message about getting support through the 988 Crisis and Suicide Lifeline.
What is 988?
It's a free 24-hour suicide and crisis lifeline.
And what is a crisis?
A family that's always arguing.
Feeling overwhelmed by school.
Discovering who you are and where you fit in.
If you're experiencing thoughts of suicide or a mental health or substance use crisis, call or text 988.
It's a listening ear.
And a way forward.
Thank you. So we've talked a lot about 988, what it is, and how it really is the beginning of us building a comprehensive statewide system. But it's only as good as its awareness. And so that is why we'll ask all of you to share with people you know about 988, right? A 3-digit number where help is gonna be available regardless of the time of day. If you're looking for additional resources, you can go to our webpage, which is 988indiana.org. And on there, they'll have links to these videos, pamphlets, and flyers that you can share. And lastly, I'll say, as we always say, if you or someone you know is currently experiencing thoughts of suicide or mental health or substance use crisis, please call or text 988 to reach the Suicide and Crisis Lifeline and to speak with a trained crisis specialist 24/7. So thank you again to all of our speakers here today. At that, we're going to open up the floor to questions. By way of reminder, if you're here in person, please come up to the microphone. Otherwise, nobody who is watching online will be able to hear you, and Amy will call on our reporters.
Yes, if you are attending in person, please wait for your name to be called and step up to the microphone. And if you are joining us virtually, please raise your hand, and once your name is called, please unmute yourself. We'll start with Annika Yoder from the Reflector of University of Indianapolis. Okay, well, we'll jump to Sophie Barnes, a journalist from the Journal at Southport High School News Magazine.
Hi, my question was, what training do the professionals go through?
That's a really great question. Right now, all 988 crisis specialists across the nation are required to complete training that is provided by Vibrant Emotional Health, which is the national administrator for 988 Suicide and Crisis Lifeline. In the state of Indiana, we are working to develop state-specific training that will enhance individuals' knowledge regarding the resources, our communities, and the needs across the state. So that will be ongoing training that our crisis specialists will get when they first start, as well as throughout the year. But that information and the training focuses on different types of callers, different types of crises, mental health diagnoses, as well as information and understanding of substance use, resources, as well as how to stabilize and help de-escalate an individual, and to provide an empathetic ear. So making sure that they are have active and empathetic listening, and ensuring cultural competency as well.
And we have an Olivia Pastrick from the Reflector, University of Indianapolis.
Any other questions?
Any other questions at this time?
If not, thank you again, everyone, for coming. And remember 988. Share that with all of your friends, neighbors, and remember it yourself. So that will conclude. Thank you all.